We have a 10-year-old female complaining of neck pain. She's been involved in a motor vehicle accident, and that's where we're at.
Okay, so PPE, I arrive on scene. Is my scene safe?
Your scene is safe.
Okay, do I notice any obstacles? Is she in a, awkward placement, or is there?
No, we have minimal intrusion, but you're able to open the door. Car's located off the roadway, and we're in a residential subdivision.
Okay, and do we have an approximate speed of the roadway?
It is a 15 miles per hour residential roadway. However, we're not too sure how fast the car was going.
Okay, and then what was the object that was impacted?
She was sitting in the rear. She's sitting in the rear. They were passing a stop sign and got hit by another vehicle.
Okay, on her side?
No, it was on the other side.
So, come up. Immediately, since she is complaining of neck pain, I'm going to have my partner immediately hold C-spine.
C-spine, sounds good.
So, I'm going to go up and talk to her. Hey, sweetheart, how are you doing? Is my patient responding?
Patient's responsive. She's able to answer all your questions.
Okay. She's tracking. Okay, so at this time, my general impression is NBC, 10-year-old female complaining of neck pain. She seems to be alert, and times 4 currently. This time, do I notice any immediate life threats? Do I notice any bleeding? Is she having trouble breathing or anything like that?
She has a couple abrasions to both arms. No significant amount of blood loss.
Okay, so I'm going to address her airway. She's obviously speaking to me, so her airway is patent. She's obviously breathing well, so I'll take my stethoscope and I'll go and auscultate across the lobes of the lungs. Do I notice any abnormalities at all?
No, breath sounds are clear and they're equal chest rise and fall.
Okay, so I'll go and check for pulse. How's her pulse?
Her pulse is at 101, and it's strong. That's about it.
All right. So not threatening at all? Or
No.
So since she is complaining of neck pain, I'm going to go ahead and assess her neck and back region.
Okay.
So I'm just going to go back here. Sweetheart, does it hurt when I push on this?
No, it doesn't hurt.
It doesn't? Okay. You're fine. Okay, so then I'm gonna go ahead and look around, do assessment. I'm gonna go to check for her head. Do I notice any like decapitated TLS, any bleeding, any lacerations?
No, she's not complaining of any pain on her head. No bleeding.
Okay, so I'm going to check her pupils while I'm here. So you can follow my pen light. Okay,
Pupils are equal and reactive. They're dilated at a 4.
Okay, and this time I don't feel the need for any additional help.
Okay. Good.
So my general impression of my patient is she's alert and oriented, times 4. GCS 15, only complaint is the neck and back pain, which is negative on palpation for pain.
Okay.
At this time, I'm going to go ahead and address her ABC, so she is speaking to me.
Yes.
So I know her airway is patent, so I'm going to go ahead and address her breathing. Got my stethoscope. Okay, I'm going to go ahead and listen and watch as she breathes. Do I notice any abnormalities?
Breath sounds are clear. We got equal chest rise and fall.
Not labored or
labored.
rapid or anything?
She is breathing at 20 breaths per minute, so it's a little rapid.
Okay. So I'm going to check her pulse. Is her pulse rapid or weak or anything?
Her pulse is at 100. It's very strong, not thready. Just your normal 10-year-old pulse.
Okay, and then as far as skin is concerned, is she sweaty?
She's a bit diaphoretic, warm.
But I don't notice any.
No, there's no abnormalities in her skin.
So at this time, I don't feel the need for additional resources. So if they're on the way, I'll go ahead and cancel them, and then we can go ahead and get this young lady moved on to the ambulance and get ready for another assessment.
Awesome.
Okay, so based on my patient's presentation, she is alert and oriented, GCS 15. I deem this non-emergent transport to the local appropriate ER. Before we get moving onto the stretcher, I'm going to have my partner apply a C-collar proactively. stretcher. We'll assist her and then get her to the back of the ambulance. Okay, start. So now that we're in the back of the ambulance, I'm gonna go ahead and go through my whole assessment. Okay, so hey, sweetheart, I'm gonna touch your head. Okay, let me know if you feel any pain or anything like that. So as I start palpating the head, I notice any deformities or
No
cuts or
deformities.
bleeding. Okay. And then as far as the eyes are concerned, we're ready to acknowledge they were equal interactable.
Yeah, they're plural. We're good to go.
Okay, do I notice any abnormalities in the jaw region?
No.
Okay, moving down to the neck. Checking for any decap BTLS.
No decap to BTLS. Slight pain to the back of the neck.
Okay, so as I start palpating, sweetheart, does this hurt?
Oh, that hurts.
Okay, so we're apology for pain.
That's perfect.
Alright, so moving down to the shoulders.
Shoulders, no injuries. Chest. Go ahead, I'm sorry.
And then, sweetheart, do you have any pain in your stomach at all?
No pain in the stomach.
I'm gonna palpate right here. Does that hurt at all? Okay. And then any stomach pain? What about when I touch the abdomen? Does that hurt?
No tenderness in the abdomen.
Okay, so just so I'm moving down to the extremities, do I notice any bleeds or any deformities
No
at all?
deformities, nothing.
Okay, coming down to the lower right extremity. Do I notice any abrasions, blood, or anything like that?
No pain. Any distal to the knee or feet.
Okay, so while I'm down here, I'm gonna check for PMS. Do I notice any pulses?
You got PD pulses on both.
Okay. All right, so we're gonna get you to wiggle your toes for me. Okay, push down hard. Awesome, thank you so much. Okay, so moving down to the left leg. Do I notice anything else as far as decap BTLS?
No.
So does this hurt at all? Okay, moving up to the upper extremities.
So we did have abrasions distal to the elbow on both arms.
Okay, and do I notice any bleeds? Is the skin still intact? Is it bruising?
Just small scrapes.
Okay. And then go check this extremity. Any abrasions on this arm?
Yes, distal to
Distal.
to the elbow.
And then I'm going to check for PMS. Do I have pulses?
Yeah, PMS. Yeah, pulses strong.
All right. So can you wiggle your fingers? All right,
Good job.
squeeze my hands. Awesome. Thank you so much. Okay. At this time, my partner will go ahead and set up vitals.
So your vitals, you have a blood pressure of 120 over 86. We have a pulse of 102. Breathing is at 18 breaths per minute. 98 on room air for your oxygen stats. And a glucose reading of 110.
All right. And sweetheart, on a scale of 1 to 10, 10 being the absolute most pain you've ever been in, what would you rate this pain?
4.
4? Okay. So, taking care of vitals, we'll go ahead and get this moving. While I'm around, I'm going to attach my patient to some oxygen, just to proactively. She also has some abrasions on her extremities, correct?
Yes.
This time we're going to sterilize the area, get rid of any debris, go ahead and bandage those up. And then I also going to give her a ice pack, kind of cool it down, put on the site of the injury,
Okay.
and get her transported to the hospital. Closely monitor every 5 to 10 minutes, and should be it.
That it? All right. Good job.